Hey, welcome back. We have Alex Beelen here, a physical therapist with St. Mary's Medical Center, the therapy center in Barboursville.
Yeah, a new study out says about 75% of youth baseball players have arm pain, and now there is a new way that they can strike out on that common injury. Alex played baseball, and you did. Did you pitch, or did you?
I didn't pitch in college, but I did in high school.
So, as a physical therapist, you can use that experience from when your youth to help kids now, and it's a big problem, and not just rotator cuff, but other arm problems too.
Absolutely, and big thing too now is also elbow, and putting a lot of stress on the elbow, which then can hopefully not create Tommy John, but that's what every parent fears, and so that's what we're trying to prevent. And then as a child, and that's the thing, you see younger and younger cases of Tommy John now with kids who are even in high school. It used to just be college and pros. And it's coming, it's too prevalent at an alarming rate, and Dr. Andrews is in Birmingham, famous orthopedic surgeon who works on a lot of athletes, is trying to set a precedent to limit how much we throw and keep track of all that. So
what should we be doing? What should we be showing kids that they need to be doing to prevent these injuries?
So one thing that we can utilize is we can use, we can actually use your phone to take video, and someone like myself who has played the game, who knows a little bit about pitching and injury prevention, we can look at it and analyze it and really kind of go by a step-by-step process to hopefully prevent those chronic injuries that we're seeing at a younger age. One thing that you always have to start with is your base. You always have to look at the feet, and you always got to look at their foot placement, their hips, their core strength, because most kids, they want to try and throw hard, they want to try and be their best, and so what they don't realize is your arm strength is not necessarily arm strength, but it actually comes from your core. And so we got to teach parents, teach kids, if you throw from your waist down, you limit the stress on your shoulder and you limit the stress on your elbow, hopefully being able to throw a little bit longer, and you're able to prevent injury, and you succeed a lot of times. So,
what about these softball girls? Wow, they really wind it up when they're getting ready to pitch.
It's a different motion, but they can also end up injured.
Correct. And one thing about softball is your natural motion is to come on like this. So we don't see a lot of shoulder injuries per se with softball pitchers, but one thing that you can and you have to watch out for is bicep tendonitis, and that's overuse. And this motion right here, and we use the term eccentrically loading that bicep tendon, which then puts a lot of stress. If you train for that, your arm can handle it. But you know, at a young age, you're growing, things are changing, muscles are moving, bones are growing. So that puts an emphasis on doing the correct technique. Again, utilizing your core, utilizing your legs to prevent the stress on that shoulder.
And overuse, again, and you've touched on it, we don't just see it in baseball. Overuse, we saw it as swim parents. We saw a number of kids go out with overuse injury, and that's the thing. Those kids are growing, like you say, and if they're overusing, there's a really good chance they're going to end up injured.
Absolutely, and I tell kids, you know, play many sports. Don't try and be specific to one. I mean, as much as you would love to play professionally, love to play in the collegiate level, coaches at those levels look for multi-sport athletes. And so if you do that, you're utilizing different muscles. You're, not specific to one, which then decreases those chronic overuse injuries. And a lot of times, they get sport specific sometimes because they just love the sport, and that's awesome. But you have to be careful. You're going to practice, you're playing probably 6 to 8 months out of the year, and then you're also training for those 4 months
sometimes
out of the season.
no off season.
So there's no off season, so there's no rest. So over time, your body can't handle that. It breaks down, injuries happen, and then, it just cascades down.
Parents. That's where parents come in.
Exactly.
We talk about that all the time. Parents have to be the ones to draw the line, because the kids may just want to, especially if they're really into it, they're going to want to keep playing.
So that's when they need to come to you, I guess, to get the physical therapy. How long does it usually take to get them back on the field?
Depends on the injury. If we're looking at tendonitis, we're looking at probably 4 to 6 weeks. If they're younger and healthier, maybe a little bit quicker. If it's a really severe injury, I may not be able to kind of work with them to get them back. I may have to have an orthopedic surgeon take a look at it. But we're hoping that, strengthening the areas that need to be strengthened, and then working on the mechanics, hopefully, decreases that time that they see me in the clinic.
That's for sure.
That's good.
Good advice. Alex, thanks for coming in.
Well, my pleasure.
Definitely perfect timing with baseball season.
Sure is.